Let's look at how we can make an entry of the patient. Let's make a OPD entry. I'm just going to show you how quickly it can be done. I click on add new. The new patient record is automatically entered. You have a registration number which is auto generated, then OPD number is auto generated. By default a patient is OPD, so IPD number is not generated. Here I just say Mrs. Sulaba SI, just a fake name. Probably I would like to add the birth date, so let's 1999, female. Probably height is 145 centimeters, weight is let's say 67 kgs. Housewife. Who has referred the patient? Dr. Manali. Consultant who is looking after the patient, Dr. Moite. Address, probably Kothur, Pune. And then I just save the patient. So a patient is now entered in the system. Then in the billing cycle, we may go to services. The billing clerk will enter a new service of the billing person, and it might be just the consultation fee. Done. Save. So I've entered this consultation fee, which might be the only cost that I'm going to charge to the patient. I go to bill, just add bill. Bill is ready, save. Normally I take full cash from the OPD patients, so in that case I just say quick full reset and a receipt is booked. Had I put or clicked part reset, then a receipt voucher would open and I have to enter the part receipt amount and so on. So as you see, this is the billing cycle. So registration, where the patient is created, registered, services, whatever, it may be one more service or two more services in addition to consultation fees like pathology, investigation services or something, and then bill. So this is a simple billing cycle. Everything happens in the same form. In the doctor's cabin, probably a doctor would be interested in clinical phase, where doctor says that okay, the patient has edema, gastrointestinal abdominal pain is there, and in miscellaneous, let's say there's a fever, to family history, replace. So he says similar illness was in mother and history suggestive of bleeding. Probably no. Similar illness, yes. Any other major illness, TB and let's say IHD. Personal, alcohol, no. How much tobacco chewing? Okay, sleep is normal. Then constipation. And then I would go to examination findings. So this will replace the earlier history findings of this patient which I might have entered, or this will append to the earlier findings. So because this is the first time I am making entry of history findings, it doesn't make a difference, so I'll just replace it. This is examination finding form, so I say pallot is present, edema is present in respiratory tract, air intrinsic wall and so on, cardiovascular normal, gynecobstetrics, product domain and so on. This form, all these symptoms, and these are the symptoms for example, and these are the options of the symptom. All this can be completely redesigned by you. You can erase all this, define your own symptoms and options, and these categorizing pages. And once your own form is ready, it becomes extremely easy for you to use it. Well, let's say I have done this. So you can see here that complaints, history and examination has become pink. Let me try to add something to history. I can do it here using view or edit case paper details. So I go to history and here I can say additional notes. So this is something I can type XYZ, whatever, and then I save it. So next time if I again click on it, I would see my additional notes here. Okay. Then let's say I want to give some advice and follow-up. So here I can say take regular exercise. This is advice I've given to the patient. Replace. Okay. I've entered complaints history, examination, advice and follow-up. Obviously we have not entered procedure, investigation, provisional and final diagnosis. So after doing this, I may go to medicine prescription. So the diagnosis is gastroenteritis. The group is, let's say, antibiotics. The medicine I prescribe is, let's say, okay. Another group, B complex. Medicine, let's say, supradine. And then I can print it in Marathi, Hindi, Gujarati, Bangla, Malayalam, and all these languages. I can quickly preview the medicine. The medicine will look like this. So it will print on a paper, and you can see doctor's name and all that. If I believe that this is a common prescriptions I have to give to a normal patient of acute gastroenteritis, I can save it to the library for future use. So I can say for this diagnosis, this is prescription 1. I may actually give this name as descriptive of this case. So that is doctor's choice. So I say done. Now you can see that procedure and treatment also has something. So this is what I prescribe to a patient. I also specified final diagnosis as acute gastroenteritis, so it is also entered. Now it would be interesting to see how this comes up in a case paper. So this is case paper. I can say regular case paper, and all the details which you have entered: complaints, history, allergy, clinical findings, investigations, provisional, final diagnosis. All this will start appearing. So this is treatment you prescribed. These are stored date-wise. So if you prescribe different medicines to the patient, maybe the indoor patient on multiple dates, you will see multiple date-wise entries here. In that case, you will also be able to select a particular date and see individual parts of the case paper, like individual information, or a date-wise case paper. So if patient visited 3 times, then probably you can see a case paper as on his last visit. So that is possible. Okay, then you can also make some analysis data entry. So this data entry is where you can define your analytical parameters, which you can use to analyze all the data that you feed for years together. And then you can get all the analytical reports here in analysis reports. Okay, then I'm going to say one way. So now this is of course a sample paper. So this doesn't apply to a gynecologist definitely, or surgeon definitely. So you can see that this is what I clicked, and I have entered in that patient's analytical data sheet. And whenever I want to see all the patients who came between age 0 and 21, this patient will feature there. Or death due to sepsis, wherever I see, I would see that this patient refers or is counted in that count, and so on. So this is clinical entry. So for a OPD patient, registration, services, probably doctor charges, and billing. These 4 pages operate at probably the reception or the billing counter, or reception and billing counter, whereas clinical page essentially operates in the doctor's cabin. If we see the medicine prescription, we know that diagnosis we had prescribed to this patient as acute gastroenteritis, and you remember that we had saved previous prescription. So if I retrieve from library, I would not be able to. Okay, so let me select acute gastroenteritis and retrieve from library. So this is the one which I had already stored. So if I select this, it will automatically reload. If I want to change this method to 2 times a day, yes, I can do that. I can print it, give it to the patient, and I may again save it to the library for acute gastroenteritis as prescription 2. So next time I have 2 prescriptions to select from for acute gastroenteritis. So as you go on using more and more medicine prescription form and go running more and more prescriptions, standard prescriptions to the library, your work becomes easier and easier. This package basically makes your work easier as you go on using it. So what we have provided by default really does not matter much, because you can define everything according to your own practice standards or practice preferences. Done.